Our second presenter this morning will be Ochiagha Clara Somtochukwu, member of the Orapu College of Scholars. Mrs. Ochiagha Clara Somtochukwu is a board-certified and licensed dental therapist. She worked with the State Dental Center, Ogun State. This morning, she'll be presenting on the topic Aging and Dental Health. Ms. Ochiagha Clara Somtochukwu, the floor is open. You can go ahead and make your presentation. Thank you.
Good morning, everybody. I will be taking us on aging and dental health. It is basically how aging affects our dental health. My presentation today will be based on a way of introduction. I'll give us the oral health conditions associated with aging, prevention of these oral health conditions, communication skills in the care of the aged patients, conclusion, and references. A survey by the Federal Interagency Forum on Aging-Related Statistics in 2021 estimates that by the year 2030, the number of American adults from 65 years and above will reach 72 million, which is nearly 20% of the total population. That is approximate doubling of number as compared to the year 2000. This means that older adults are growing patients in the demographic for dental practices. Even though an approximate figure of 5% of adults older than 65 years are dentalous, increased number of older adults are retaining their natural teeth compared to the previous cohorts. In 1999 to 2004 National Health and Nutrition Examination Survey, an approximated percentage of adults 65 years and above retained their natural teeth and have untreated caries. Well, about 68% of these patients have periodontitis. Aging causes a change in our body tissues, in our cells. So for us to maintain good oral health, it is also important for us to consider our general health, because if we take care of our general health, then our oral health will also be maintained. There are oral health conditions that are associated with aging. These conditions can occur independently or interdependently, or at the same time, or they can also occur as sequelae to one another. These oral health conditions include xerostomia, caries, gum recession, attrition, dentinal hypersensitivity, halitosis, edentulism, to mention but a few. Xerostomia is a condition that results from low production of saliva in the mouth. And saliva protects the mouth by buffering all microbial activities and returning the mouth to a normal pH. So because there is saliva in the mouth is bound to be protected. But when there is reduced flow of saliva in the mouth, that protection barrier has been broken. This dry mouth, also known as xerostomia, can be caused by the medications these older adults use, because they are exposed. They come down with some comorbid conditions such as diabetes, Alzheimer's diseases, Parkinson. So the medications they take can actually affect the saliva production in their mouth, and that way the protection barrier is no longer there. It predisposes them to xerostomia. We advise that these older patients, when they notice that they have reduced salivary flow, should increase their water intake. That way, even if the medications are affecting their saliva production, at least there is enough water in their system to produce saliva. It is also advised that a review of their medication be done where possible to manage giving them medications that do not alter their salivary function. There is also, xerostomia also can lead to halitosis, because when there is reduced flow of saliva in the mouth, there is nothing buffering the activities of these microorganisms, and they produce toxic substances that can cause the mouth to stench. It can also predispose the mouth to caries, because the saliva is supposed to be there to protect the teeth from these acidic substances, these toxic acidic substances produced by the microorganisms in the mouth when they react with sugar. And there is gum disease. 75% of older adults are affected by gingivitis, and this is as a result of poor oral hygiene. It can also be as a result of dry mouth, as a result of smoking, uncontrolled diabetes, and weakened immune system. And because gingivitis is painless at an early stage, we usually do not find that. So it's advisable when an older patient brushes and notices that there is bleeding in the mouth, he or she is supposed to report to the dental clinic so that it can be taken care of. And we'll advise that they improve their oral hygiene. But when these things are left unattended to, it progresses to periodontitis, which is the loss of supporting tissues around the teeth, which eventually leads to edentulism, otherwise called tooth loss. This condition can be prevented and managed by improvement of oral hygiene, early diagnosis and treatment to prevent managed diabetes and some other systemic diseases that occur in the elderly people. So we can prevent and manage this gum disease by improving oral hygiene and by early diagnosis and treatment of the oral hygiene of the gingivitis, and also by managing properly these disease conditions that can lead to periodontitis. Another oral health condition that is associated with aging is attrition. Attrition is a continual process. It happens throughout life. It happens continuously but slowly. And because it is irreversible and cumulative with age, we advise that the use of mouth guards be introduced to patients who gnash their teeth or who have something we call bruxism, because this attrition can also expose the dentine and it will lead to dentinal hypersensitivity. The prevention of these oral health conditions, alongside controlling and managing the systemic diseases associated with the elderly people that can also predispose these elderly people to oral health conditions, we are also advising that these elderly people take good care of their mouth, and these oral hygiene practices include brushing their mouth twice a day, preferably after breakfast in the morning and the last thing before they go to bed. And also they should floss at least once a day. They should also avoid using sweets or sugar sweetened beverages. They should also quit smoking or use of tobacco if they do so. And they should drink a lot of water to increase salivary flow. And then see a dentist for regular checkups. When you visit a dentist for regular checkups, the dentist sees when there is a problem that is cropping up in the mouth and alerts you on time and to begin treatment immediately before it progresses to something that cannot be handled. Most oral health conditions are reversible at an earlier stage. So if we notice these things on time, we can actually contain them and treat them. But when it takes too long, we may eventually lose a tooth or maybe not be able to manage them to treat them We then go to management. There are communication skills that is needed in the care of the elderly patients, because as we all know, most elderly patients that come down with these systemic diseases may have hearing problems, they may have bad eyesight, they may have cognitive impairments. So these communication skills are needed, they are very necessary in the care of these aged patients, especially in the dental clinic. For patients who are lip readers, you face the patients while speaking. You gain the patient's attention with a light touch or signal them before you speak. You inform the patients before starting to use dental equipment or when equipments are changed. Like if you're doing scaling and polishing for a patient and you were using an ultrasonic scaler, but because you notice that this patient is having hypersensitivity, you want to switch to manual. You tell the patient that, okay, you're dropping this for now and you want to change to manual because he or she is feeling sensitive here and you really need to work on that. So this is why you are changing to manual, so the person will not feel that sensitivity anymore. Then for patients who wear hearing aids, you minimize the background noise when speaking to them and avoid sudden noises or putting your hands close to their hearing aids, because these hearing aids tend to bring all the noises around close to them. So when you take your hands closer to these hearing aids, it increases the noise in their ear. So they may or may not hear what you are trying to say. Then for patients, who still use hearing aids, there is use of large print magazines. For patients with visual impairments, we use large print magazines, good lighting throughout the office. We use contrasting colors, large prints on prescription papers, and the use of blinds to minimize the rate of sunlight that gets into the clinic and can affect their light accommodation. In patients with loss of mobility, it is recommended that we give them toothbrushes that have larger grippable handles to brush their teeth, or even electronic toothbrushes that are grippable. They have large handles, they can hold them firmly, because the tiny ones can slip off their hand and they may not be able to brush. ADA 2021 also recommended the use of floss holders and interdental cleaners to aid in cleaning between the teeth. Increasing the frequency of dental cleaning and examination can also promote optimal maintenance of oral hygiene. In patients with severe mental impairments, patients that have conditions like Alzheimer's disease and dementia, it is encouraged that their caregivers are also educated, as well as there is education of the patients. Shen in 2014 discussed that communication during dental appointments may be challenging when older patients have mental impairments. So they recommend that the number of people and distractions and noises in the operatory room be minimized when providing care to these patients. They also advised that these patients should be approached from the front at the eye level, and the use of nonverbal communication such as smiling and eye contact and waving and showing you what you want to do should be encouraged. In conclusion, there is an estimation that shows that the demographic of older population will continue to increase and reach as much as 20% of the total population by 2030. Also, the population of older patients retaining their teeth is expected to increase, because we now know that there is a relationship between aging and dental health. So we advise they come to the clinic more frequently. We advise that they take proper care of their mouth. That way, there is reduced loss of tooth. These projections means that more older patients are expected to present at dental clinics Therefore, it is necessary to have a sound understanding of their oral health conditions that are associated with aging, their prevention and their management. This way, optimum care for their teeth is achieved. Thank you.
Thank you, Miss Clara Somtochukwu, for this wonderful presentation. You've actually done justice to this topic. We really appreciate. I remain Haggai Silas, a member of the Orapu College of Scholars, the lead moderator for today. We will be taking questions, answers, and contributions at this time. If you have any question, any contribution, you can unmute yourself and go ahead. Our presenters for today are here for you to answer your question and to respond to some of your contributions. And if you can't speak out, you can type it maybe on the platform. Our presenters will reply you and we'll move forward together. The floor is open for contribution and questions.
Hello.
Yes, we can hear you, sir.
Good morning, everybody.
Good morning, sir.
Okay. I want to appreciate the presenters for the job well done, particularly the first presenter. I really appreciate her for the thorough work she has done. My question is, though I don't know the scope of presentation, but I didn't hear anything about ethical process, because coming to collect data from people in the clinic or wherever, there should be some elements of clearance or clearances to be gotten. So that's just the area I want to contribute. And then that's on that. On the second presenter, she did very wonderfully well. But I want to ask, see, most times our studies, when she was making her presentation, especially in the introductory part, she said that, she was using US as a reference point. So I'm wondering whether we do not have any statistics or statistical presentation on this other side, because most times we quote those the whites. So I want to suggest that subsequently, we can get figures around Africa, Nigeria, then other countries like that. Do you understand? So that's my contribution. Good morning, everybody.
Thank you very much, sir, for this question and contribution. Our first presenter, I don't know, are you here with us?
Yes, I am. I'm here.
Okay. His question about ethical process. It was like, before getting data in the clinic, at least you must have clearances and other things like that for you to have access to that data. What can you say about the ethical process?
First of all, there are two very important things to be taken into consideration while sourcing for health data. You need to consider a patient's approval and data privacy also. Approval in the sense that for instance, when you're giving out questionnaires, you are not allowed to infringe it on them or to force them out of it. You should explain why you're giving them the questionnaires and give to those who are willing to take the questionnaires from you. So I really appreciate that question. The second one, data privacy. You should tell the patient that maybe for interviews where you have where patient's medical history is collected. As part of your introduction, good morning, my name is Jessica. Welcome to the clinic today. Anything you say is between us. I think a phrase like that is very reassuring. It allows a patient to properly open up to you. So you ensuring that he or she is aware of the fact that that anything he or she tells you is not going to be a news for the public. If you assure a patient that it's just going to be for the purpose of his or her treatment, I think that's main. I'm not sure, but it's what I think the whole ethical thing covers. You seek his or her approval, and then you ensure him or her that these things you're saying will not leave this room. Or even if they leave this room, it's for the process of you getting good health, or for you to achieve or attain good health. Thank you. I hope I answered that.
Thank you very much, our first presenter. Concerning our second presenter, it's an observation, and I think all of us can go ahead and work with that. Our epidemiology and other issues like that should be expanded, not only concentrating on the whites, but in other African countries and other regions. Thank you, Dr. Kelechi, for raising that observation. We really appreciate. The floor is still open for questions and contributions. If you have one, you can go ahead. Is somebody speaking, please? Contribution, questions, and observation. Kasha Gloria, are you speaking, please? Miss Kasha Gloria,
my
we can't
network
hear
is
you,
very
please.
bad. Sorry. My network is very bad. Sorry. My question is,
Oh,
after blushing, are you hearing me?
yes, we can hear you,
Hello.
ma'am. We can hear you. Go ahead.
After blushing, what way you can prevent halitosis?
Okay. Is that your question?
Yeah.
Thank you. Okay. I think this question goes to our second presenter. After brushing, in what ways again can you prevent halitosis?
Yes, sir.
You can go ahead and answer, presenter.
Okay, thank you, Gloria, for that question. Halitosis can be, the causes of halitosis can be multifactorial. It can be as a result of systemic disease. It can be as a result of poor oral hygiene. So, in the management of halitosis, apart from brushing, you also introduce flossing at least once a day. You make sure you do not eat and leave sticky substances in your mouth. So by this I mean, whatever you eat, you rinse out your mouth properly.
Yes.
Very well. Make sure you brush your tongue very well when you are brushing your teeth. And if it still persists, the likelihood that it could be as a result of systemic diseases like peptic ulcer. It could also be as a result of presence of dental caries in the mouth. Maybe there's an infection going on in the mouth that is causing you to have that malodor. So for as long as you take care of the underlying conditions that could cause this and you improve your oral hygiene, you're good to go.
Okay, ma'am. Thank you so much. All right, I'm you.
Thank you.
Thank you, sir.
you, Miss Clara Somtochku, for that answer. I hope you are satisfied, Miss Gloria Kasha.
Yes, I'm satisfied. Thank you very much.
This is Orapu College of Scholars Oropposium 3. Okay, you're welcome, ma. This is Orapu College of Scholars Oropposium 3. We just took 2 presentations from our scholars, and the floor is still open for question, observation, and anything you have for us. Please, if you have anything, you can go ahead before we round up. The floor is open. Miss Elizabeth Oji, are you speaking, please? Elizabeth Oji, are you speaking? Please, can anybody hear Elizabeth Oji? Elizabeth Oji, can you hear us, please? Okay, it seems you have a network issue. Can anybody hear Elizabeth Oji, please?
No, I can't hear her.
Okay. Okay, the floor is still open for question and contribution, if you have any. We just took 2 presentations, aging and oral health, and the first presentation is how to gather data in the clinic. From our 2 scholars this morning, the floor is still open. If there is no any observation, contribution or question, maybe we will round up now. Okay, thank you very much for your time. Thank you for availing yourself to attend this wonderful presentation of the Orapu College of Scholars. I will now give time. Hello, sir.
Yes.
Go ahead,
Good
Mr.
morning.
We can hear you.
Okay, thank you very much. I was trying to call your attention privately, but it looks like you were kind of very busy. I want to appreciate everybody for creating time to be with us this morning for the Oropposium 3, just to us or to inform us that today is our Founders Day here at Orapu. It's been 2 years that we kickstarted Orapu program, and today marks exactly 2 years after Orapu started. We want to appreciate everyone for believing in us. We want to appreciate everyone for partnering with us. We appreciate the students at the college. We appreciate those at the Orapu community. We appreciate those at the Orapu Journal, those at the Orapu School, and those at the college as well, those that are contributing to literature reviews. We say a very big thank you for trusting us and believing in us. Thank you very much once again, and we wish you the very best going forward. Thank you. Back to the moderator, sir.
Thank you. Okay, thank you very much, Mr. Behimba Iba. It's indeed a great honor and privilege for us to be here. I assure us that Orapu College of Scholars is having a lot in store package for us. Let's continue to avail ourselves for the subsequent presentations. We will be taking our Oropposium 4 next week, Saturday, God's willing. Try and be there. We appreciate everyone. Our presenters, you have done wonderfully well. Our participants, we thank you. We really appreciate you. Thanks having you. Do have a great day ahead. Bye for now.